What is Change Healthcare? In 2004, WebMD Corporation acquired Dakota Imaging Incorporated and VIPS Inc. Dakota Imaging is a provider of automated healthcare claims processing technology and business process outsourcing, or BPO services. VIPS is an information technology company that supplies decision support solutions and consulting services to government, Blue Cross Blue Shield, and commercial healthcare payers. In 2005, the name was changed to Emdion to separate these holdings from WebMD. Between 2009 and 2012, Emdion continued to make acquisitions of healthcare-focused payment service companies. In 2007, a company called Change Healthcare was established and focused on consumer-level health insurance costing tools. In 2010, the company switched focuses to a business-to-business market. In 2010 to 2013, the company continued to grow and receive various rounds of private equity funding. In 2014, Change Healthcare was purchased by Emdion. In 2015, Emdion rebranded to Change Healthcare. Change Healthcare continued acquisitions until 2021 when United Health Group's Optimum Insight agreed to purchase Change Healthcare for $13 billion. This deal was delayed due to regulatory scrutiny and closed in 2022. What does Change Healthcare do? Change Healthcare serves many market segments, including physicians, clinics, hospitals, payers, pharmacies, dentists, and government services. Some estimates as old as 2015 have put the number of hospitals that use Change Healthcare at 5,000, 60,000 pharmacies, and 105,000 dentists. Currently, it is estimated that Change Healthcare handles as many as 1 of every 3 patient records in the United States. Change Healthcare breaks their products into 3 major categories: payments and revenue cycle, clinical and imaging, and patient and member engagement. Each one of these categories provide many solutions for each of the different market segments that target. One of the biggest things that Change Healthcare does is process billing claims with insurance. For example, if a doctor wrote you a prescription, the pharmacy can submit the claim to the insurance company to see how much will be covered and how much the patient is responsible for. When Change Healthcare suffered their cyber attack in February 2024, they disconnected themselves from their customers. So in our previous example, the pharmacy is not able to process the claim to see how much the patient needs to pay for their medication. This is only a simplification of what Change Healthcare handles. In addition to handling systems for obtaining insurance approvals for medications or procedures, they also handle the payments to providers for those medications and procedures. This can be as high as 15 billion transactions per year. How does this affect you? Depending on what type of care you're looking for, this attack can cause delays in approvals for your procedures or paying the correct cost for medication. In addition to these direct initial effects, there are financial and economic effects starting to build. Providers are not receiving payments for their services rendered. This causes a direct disruption to their cash flow. According to a New York Times article from March 5th, this can be seen as a cancer center not having the money to purchase chemotherapy drugs to treat cancer patients, or an urgent care chain not being able to pay rent or cover employee salaries. The longer this cash flow is stopped, the farther the waves will reach. This is an example of how a patient pays their bill through Change Healthcare, which then pays the hospital. March 5th, 2024, the U.S. Department of Health and Human Services issued a statement concerning the steps that the Centers for Medicare and Medicaid Services, or CMS, are taking to assist providers in continuing to serve patients. Some of these steps include the ability for Medicare providers to switch the clearinghouse used to process their claims during these outages. CMS is also encouraging Medicare Advantage and Part D sponsors to remove or relax prior authorizations and to offer advance funding to providers most affected by this attack. CMS also stated that there have been some providers making accelerated payments available. The Department of Health and Human Services also spoke on the interconnectedness of the domestic healthcare system and the importance of strengthening cybersecurity in the industry. The hospital industry has described the Health and Human Services response as inadequate. All of this shows the criticality of these payments being received on time. Pharmacies were the first ones to feel the effects of this attack, and now we are seeing how it affects providers. If payments do not begin to reach providers, they run the risk of running out of money to provide services and remain open. In the case of the urgent care change in Ohio, they currently have 650,000 in unpaid claims. They are now prioritizing which expenses get paid first and have worked to secure lines of credit along with personal savings to cover salaries for the next 2 months. This is not an isolated example. As this attack remains unresolved, the larger the affected providers become. This can also affect individual providers, such as single physician practices and therapists. There are several examples of Optum's loan program to help providers falling short. For example, the New York Times article spoke with a provider who submits $4,000 and claims it was offered a $20 per week loan. A primary care practice in Pennsylvania was offered a loan of $4,000 compared to the $500,000 of claims per month the practice submits. As of the recording of this video, United Health Group has not provided a timeline for when Change Healthcare will be reconnected to the network. On March 1st, 2024, a Bitcoin address linked to Black Cat, the alleged hackers behind the attack, received a $22 million transaction. United Health Group has declined to comment on that transaction. This attack has brought into question the consolidation of these large-scale medical companies, such as the United Health Group and Change Healthcare merger.